Hey, how you doing? I'm Greg Wrigley, founder of Xylem Design over here in Fort Collins, Colorado. I want to share what we're doing to help with the people on the front line deal with this virus in the hospitals. So what you see over my shoulder here is called an intubation chamber, also known as an aerosol box. And the whole purpose of it is to create an environment that contains the virus and the atomized spit that you deal with when you're putting all of the equipment in and out of the poor person being ventilated. So this is, to me, I think the most critical piece of simple hardware in the frontline attack because it helps reduce the exposure of the physician as well to this. So how it works is it basically is a three-sided box. The patient's body is obviously going in here, acrylics of pain, but you can see their head and shoulders go in there, and the patient gets draped with draping material, and then this side, obviously this is just paper, but this paper gets peeled off, and it's visually an open arena for the physician to do the process. This opening here gets covered with shrink wrap, and then the physician just slices that and puts their arms in there to do the procedures, and then pulls it out, and it's basically a self-sealing concept, and they can just put more shrink wrap right over it if it doesn't seal properly. So this design has been worked out, as I may have said. It started over in Taiwan. Some friends of mine over in Ireland, or friends of ours in Ireland, developed this further. The dimensions are 24 by 16 deep by 20 tall. It's high enough to give the operator enough movement of their forearms. I like the open design. There's also some designs with two holes. Either way, there's a lot that they do in there, so this doesn't inhibit the movement of their arms. But either way, this is a fighting chance to keep the exposure of the virus minimized to the people who are trained doing this very critical last ditch work. And so I'd ask you to take this and share this with anyone. We are a highly talented, lean organization here. We're a manufacturing operation that knows what we're doing. We'd love to help the people on the front lines. This design is designed to be stacked, which is why it's that open angle. They can be stacked and shipped in a compact format. Also, while we're here, we have another simple visor that is held up by the patient while they're interacting with the doctors to make sure that they, again, minimize some of the spit that goes around and contains this virus. So please use all of your social media skills and share this with anyone. If you want to screenshot it, you name it. But I'd love to hear from anyone directly so I can talk to anyone who's a decision maker at the hospitals, connect me to the people on the boards, you name it. We're talking with a couple hospitals back east and trying to get some traction with their higher ups to make the decisions to get these moving. We have material queued up, ready to go, and we know what we're doing. So please share this as soon as possible with as many people as possible. Thank you.